Good afternoon. Today it's my great honor to welcome our very own Dr. Margaux Suteau to our seminar. Margaux is a fellow in our social policy department, and I personally have the pleasure of teaching with Margaux on several education and research methodology courses in our department. But Margaux's own research focuses on two areas. One is to understand the persistent gender disparities and how to address them with policy. The other is on beliefs and cultural norms and how they influence education and economic outcomes. Margaux has a PhD in economics from CY Cergy, Paris University, and ESSEC Business School. At LSE, she's also an active member of the Women in Social and Public Policy Research Hub and organizes its annual workshops. And one is coming up next month on the 13th. On the 12th, sorry, 12th of March. So yeah, today we'll get a taste of Margaux's very interesting and important research. So without further ado, let's extend a warm welcome to Margaux.
Very much for coming to this presentation. So thank you, Shuang, for introducing me. Indeed, I've been in the department for a few years, and I'm so around that once Damien actually asked me if I had a place to stay. If you've never seen me, it's probably on you, and you should come to the office more. So this is George work with my great colleague Paola Pudi, who is a researcher at University of Barcelona, Paola Profeta, who is a professor at Bocconi, and Almudena Sevilla, who is a professor here in the department. So the paper's new title is The Bystander Issue, Understanding the Role of Beliefs in Workplace Sexual Harassment. So today we're going to talk about sexual harassment and how to tackle the issue using trainings specifically for bystanders. So as you may know, and for those who received the great email from the school today, sexual harassment is a systemic and pervasive issue. Studies have found that sexual harassment does not only impact victims, they also impact firms and society more generally. Nearly 6 EU women in 10 reported having been harassed in the workplace. But when we asked them whether they reported it at least to superior, not even to the police, we find that only 9 to 16% actually did. So there is a need for understanding why victims are not coming forward, and what are the constraints that they face in coming forward. And so we were not the first researchers to actually try to look at this issue. There is a qualitative literature from psychology that actually highlighted the role of harassment myth. So the fact that bystanders tend to disbelieve victims, blame them, and side with the harassers because of those harassment myths and the valorization of masculinity in fostering those network of silence around sexual harassment. So you might have heard those myths from the news, or anecdotally, the fact that women tend to exaggerate their claim or even lie about harassment, the fact that they actually derive enjoyment and feel flattered by sexual harassment, or that the impact of sexual harassment, not only psychologically or physically, but generally for their career, is actually very minimal compared to the one of the harassers who might be suffering from a lot of stigma, etc., etc. And this is joined with an emerging literature more on the quant side on looking at the causal role of beliefs on decision making. For instance, the role of gender norms in labor market and labor force participation outcome that led us to focus specifically on the role of beliefs. However, what do we want to do for these beliefs? Well, we want to understand whether that can be the triggering force behind the effect of potential trainings and potential solution against sexual harassment. Indeed, without much evidence, a lot of organizations around the world have been trying to implement sexual harassment training, part of what we call DEI initiatives, so diversity, equity, and inclusion initiatives. But actually, as I said, the results are quite mixed on the effectiveness of this training. And some papers even show backlash, so the fact that some people react very negatively to the sexual harassment training, so they're not actually helping. So by focusing on belief, in explaining the willingness to support victims, what we want to do is to open the black box of those trainings and to understand why they would work, why they wouldn't, why they would even have a negative impact on overall sexual harassment. So to do this, we have 3 research questions that I'm going to tackle in order. First, we want to understand quantitatively if workers are actually holding systematic biases about the prevalence and implication of sexual harassment. And I'm going to add here, beyond prevalence and implication, we also want to understand what we call bystander efficacy. Well, it's not what we call, it's the literature called it. I'm not going to give too much credit to myself for this. But what the literature called bystander efficacy, so how you feel about being able to help in a situation. Okay? And we're going to look at how those beliefs are linked to individual characteristics and understand a bit more the context. Then, of course, we want, again, to see whether those beliefs are correlated with actual willingness to help the victims. Do those beliefs, if they exist, actually matter, and in what way? And from this, we'll try to see whether we can modify those beliefs by providing information to our respondents and seeing how they answer. This will allow us to see whether we can change belief 1, and first, what type of training is more adapted to change those beliefs in the right way. So in practice, what does it mean? We run a unique survey on French workers. We collect individual characteristics as well as individual beliefs about harassment. We randomize access to information treatment, so that basically that's an RCT embedded in a survey about the prevalence of cost of sexual harassment, as well as a short training on good practices when faced with sexual harassment. And finally, we assess willingness to help through real state questions. I'm going to explain to you what real state questions means in this context. In terms of our contribution, I've already given a bit of a hint of what we're doing and how do we contribute. But first, what we do is bridging this literature on psychology, this qualitative literature around beliefs, around sexual harassment and how they can be a constraint to victims coming forward. And we explore them using methods that are emerging from economics and quantitative literature on how to identify them and how to look at their impact on real life decisions. Next, we try to explore in details why do we find mixed effect on the effectiveness of those sexual harassment training by providing information treatments that mirror real life training and things that already exist in the workplace without much evidence on their efficacy. And finally, because we collect what we consider a lot of data and a lot of characteristics, we're able not only to see what type of training works, but on who they work. And you'll see that it matters a lot in understanding why the literature highlight those mixed effects of sexual harassment training. Okay. So the talk is going to be divided in 4 parts. First, I'm going to go a bit more in the survey and how we collected it and what type of information do we have. Then we'll talk a bit more about the beliefs. We'll look at the correlation between beliefs and the willingness to assist victims. And finally, we'll look at our experiments and how information affects people's willingness to help. So the survey was collected through Meta, so Facebook and Instagram, following a new literature that has used Meta as an alternative to survey company. And we targeted individuals working in France who were between 18 and 65 years old. In our pilot, we used Meta and we found that Facebook and Instagram have a tendency to optimize people who respond to those ads, because in practice, that's basically ads. And we found that basically it was optimizing on gender and age and targeting older women for some reason. So what we did is we stratified those ads. So we had 6 different ads by age and gender to avoid this optimization. And at the end, we obtained more than 1,700 observations. So this is an overview of the survey. Just what's important in this graphical representation. So the first 3 blocks are basically the individual characteristics. Then there's the measure about prior belief, and the measure of prior belief mirror the treatment. However, it's just important to say for clarity, all respondents answer all questions about beliefs, And then they are randomized into one treatment. So they answer all the question about beliefs, but then only get one sort of information or no information at all if they are in the control group. And then everyone answers the same outcome variable. So to go into the details of the block, first in terms of individual characteristics, nothing very innovative compared to the existing literature. Socioeconomic background, age, sex, diploma, but also work characteristics, so types of work, type of firms, and something I forgot to mention, which is the share of men and women in your workplace. So not the company, but the place you work on a daily basis. Experience of discrimination. Here we ask them whether they've been experiencing discrimination or certain form of behaviors. And because we wanted to blur the objective of the survey for social desirability bias, we didn't want our respondents to understand straight away that we were working specifically on sexual harassment. We actually asked them a large variety of different types of discrimination and behavior. So not only on gender, but also sexuality, handicap, form of moral harassment, etc., etc. We use gender norms from the work value survey, as well as risk-taking and empathy perspective taking, which variables which are from the literature, so nothing very innovative here, and they're self-reported risk-taking and empathy questions. Next, our big important block, the belief questions. So we ask beliefs about harassment based on the existing qualitative literature and to mirror the information treatment, so to be able to really tackle specifically what people are thinking. So the first belief question is about the prevalence of sexual harassment. So basically we ask them, over 100 women in the workplace in France, how many do you think have been harassed in their workplace? Next, we ask them about the cost of sexual harassment. So here we ask them, okay, over 100 cases of sexual harassment in the workplace, how many do you think ended up at the victim's detriment and at the harasser's detriment? And here we make it clear that we're not only looking at physical and psychological consequences, we also tell them that we're looking at career advancements, wage, etc. So more broadly, consequences beyond the harassment itself. Then we ask them about whether they feel confident in helping in case of sexual harassment. So basically, we ask them to give us if they have a good knowledge, foreknowledge of what to do when faced with sexual harassment. So this is self-reported, but because we're researchers, we have a hard time trusting people, we also make them pass a sort of little test on where we give them actual good and bad practices, and we ask them if they think this is good or this is bad. And from this, we calculate some sort of score that we will call actual score in the following. Okay. So the first two questions are what we call the belief about the situation. The two last are more about the perceived constraints or constraints for acting as a bystander. So then we have our information treatment and our control group. Again, everyone answers all of those questions, and then they are randomized into one of the groups. The first group, we give them information on the prevalence of sexual harassment. For those data, so to give them the prevalence of sexual harassment, which we know is something that is very complicated to actually measure, we cross-validated several sources to find a number that seemed to be a good consensus in the literature for France. Okay? So this is equivalent to 33%, basically, 33%. Treatment 2, they will get information on the consequence of sexual harassment for the victim and harassers. So here we use a survey from a survey company in France that asked witness and victims of sexual harassment to say if the situation of harassment ended up that they witnessed or that they lived ended up at the victim detriment or at the harasser's detriment. And we give them more insight on those data, such as how many experienced a career blockage, how many experienced the fact that they had to quit their job, etc., etc. Information 3 is a kind of a crash course on good practices in terms of sexual harassment. And here we use the Royal Economic Society's training that was done during one of the conference. It's a very simple training that used one method that we call the 4D. So I don't have them in mind, and I looked it up just before the presentation, so I really have a goldfish memory. But it's delay, be direct, and so very simple practice when you're witnessing a situation and to basically help victims. We don't say much apart from that, just here are some good tips to be an active bystander and to help in those situations, be direct, blah, 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 blah. Then we have a passive control group, no information at all. And we have an active control group just to make sure that our results are not just about having some form of information. And this active control group gets information on moral harassment, so nothing to do with sexual harassment. And it's just the legal definition, so just a paragraph of the legal definition of moral harassment from the French law. Okay, so now how do we measure willingness to help? And that was a very important part of our paper because most of the literature, again, on those sexual harassment training looked at a lot of self-reported variables, such as, do you think that now you know what to do in case of sexual harassment? Have you been helping people in those cases after the training, etc., etc. And we think it's good, but we also know that those trainings are faced with a lot of social desirability bias, and that those self-reported variables are not necessarily accurate. So what we did is, again, leverage this the economic literature on survey experiments, and used what they called realistic questions. So we asked them first, are you willing to sign a petition against to call actions against sexual harassment in the workplace? And we tell them that they can sign, they can decide not to sign, they can sign with their name or without their name. If they decide to sign with their name, we ask them their name and we tell them that this is going to be made public. This hasn't been yet because we're waiting for the end of the whole project, but the idea is this is a very public commitment. Then, because we incentivized our respondents with gift cards, so 300 euro gift cards, we tell them that they can decide to give some of this money to a charity that helps victims of sexual harassment in the workplace. And here we have two questions. First, just a yes or no question. Are you willing to give some money to a charity? And then we ask them the actual amount. So one is non-binding. You can say, yeah, I want to give money. And then the next question, when we'll ask you how much, you can say, well, so we'll see that the distinction is important. And finally, and I won't present results on this today for the sake of time and for the sake of not having perfect results yet. The others are perfect, but still very much work in progress. We use a conjoint experiment where we'll we'll try to assess willingness to work with an alleged victims or alleged harassers. So basically what happens is you will have a choice between two colleagues, and the characteristics of those colleagues will randomly vary with for each pair of colleagues. So we'll vary characteristics on experience, how many years you've been doing this job, gender, and whether there are rumors that you've been you've been harassing a colleague. There are rumors that you've been reporting a colleague to the managers, or no information at all. And we ask them to do those choices 4 times. So if you're interested, hopefully very soon we'll have a better results to show. So far, the results tend to go in the same direction as our conclusion that I will talk about. But yeah, we're really excited for this part as well. So in terms of our survey, yes.
Sorry, can I ask a question about the number of questions in the survey?
Yeah.
How many are there?
Oof, a lot. Yes.
Yeah.
Yeah.
So, I mean, give us a rough estimate of how many questions?
Between 30 and 40, I would say.
Okay, and how long did it take respondents?
15 to 20 minutes. It was very long.
Wow, okay.
Yeah.
And just the last one?
Yeah.
€500,000 to run the survey, at least? You said
No, it was a lottery. So you
Oh, the
have a chance
lottery.
to win
Oh, I
money.
thought.
Oh, yeah.
Oh, okay. I'm sorry.
Tell me how much it was.
I was like, oh my God.
Yeah,
I didn't hear you. You said they get entered to get.
no,
They
yeah,
get
yeah.
entered to win that.
No. They entered the lottery. Oh my God, yes, sorry. They entered the lottery for 3 cards.
100.
Yeah, so
euro,
300.
Not 300. Okay.
300 euros in total for this incentive. Yes. Yeah, yes.
I think we have a quick clarifying question. How do you define sexual harassment? Because you can go on a spectrum for
Yeah.
something that's mild and makes you
Very
very
good.
comfortable, but also something that's just like.
Yeah, very good question. So the thing is in the survey, we debated a lot on whether we want to define it or we want to leave it as if and see whether that changed something. What we ended up doing at the end is to give the legal definition. So the French legal definition before the beliefs question. So that's how we defined it. However, and that's also something we need, it's on our to-do list. We have open-ended questions where a lot actually of respondents gave personal experience, although the question was not directly asked that, but a lot of people had that to say. And so what we want to do is to use this maybe to see whether they understand it in something that is the legal definition of above. We use the legal definition because what else?
What is it? I mean, for just better understanding in terms of how they.
So I don't have the exact phrasing. I should have it on the site, but the point is it's repetitive behaviors that are linked to gender and sexual behavior of a sexual nature that are repetitive or that happen once if to a certain degree of gravity. Doesn't make a lot of sense, so I should have the definition somewhere in this. But basically, that's the idea. There is the idea of repetitive of a sexual nature. So, for instance, sexist remarks that are like all the time in the workplace, that counts as sexual harassment. Okay. Any other question before you move on? Okay, thanks. So we did pretty good on our survey, on the representativity of the survey, despite not spending €500,000 on this. It's definitely not the prize. So basically, this is our sample, and this is the labor force survey from the Ministry of Labor in France. And so what we find is that we're doing pretty good. The only thing is we're underrepresenting young people and blue-collar workers, which kind of goes hand in hand, of course, because the young 18 to 25 individuals who are not in education are mainly working in France as blue-collar workers. So that's something to take into account in inferring in external validity of our findings. However, we use re-rating techniques to check the validity if we try to re-sample using again the labor force survey, and we find that our results hold. So we don't think it's a big issue, but of course it's to take into account. Okay, so just a few descriptive statistics on what we find in terms of harassment and especially bystanders. Because one of the other questions, of course, is first, maybe our respondents just never been bystanders. Maybe there isn't bystanders. Maybe people don't see harassment. So here the question is, have you personally experienced discrimination or witnessed discrimination at the end of someone? And as I said, we have a bunch of discriminations, but here I focus on gender discrimination for sake of time. So the first columns are it's very, very short, very small, it should be bigger. So this is women, this is men. The first green column is victims, blue witness, and white victims and witness. And we had a hard time deciding how to plot this, but basically this part is also here. So it does not add. It's just to show you that here, if it are all the people that said they are victims, all the people that said they are witness, even if they say that they were both. Okay. So what we find is that at least 20% of women in our sample have experienced personally gender discrimination. Around 5% of men also said that they've experienced gender discrimination. More importantly, more people report that they've been witness. Almost 23% of women report they've been witness of the gender discrimination, and almost 30% of men report that they've been witness of gender discrimination.
Sorry, Margaux, you're saying gender discrimination, not sexual harassment?
No,
here. Yeah.
no. Here it was before the legal definition, so we let them understand. It's their own understanding of what is discrimination. But we go into the details with. I mean, it's still open for interpretation, of course. But we go in more details with specific behaviors. So here we have that. We ask them, have you personally experienced or witnessed any of the following behaviors? Sexist behaviors. And again, what's striking is that almost 40% of women report that they've been experiencing sexist remarks, and more than 40% of men report that they've been witnessing sexist remarks in the world. The one thing is, if we look at touching without consent, so what we can describe as assault beyond sexual harassment, we see that those type of behaviors still happen more in private. So here they are less bystanders. So that has an impact on the potential effect of our policy. However, this is still something that is very important. Almost 20% of the sample report have been of women report have been touched without consent in the workplace. So for this first part, our survey maps other sources of information in France. Between 25 and 30% of the sample experienced some sort of sexual harassment. Again, as we in a vague definition here for now. Men also reported experiencing gender discrimination and other forms of sexual harassment, but although less than 10% do, so women are still disproportionately victims. And the fact that men still report some harassment is not, it's also seen in other countries and all the papers in the literature. Importantly, our survey also shows that bystanders exist and they do witness the situation. So that leaves room for policy implications. Okay, so second part of the paper now, what about the beliefs? We talked a lot about beliefs. What about the beliefs? So here we ask them again, the first question, what percentage of women do you think have been victims of sexual harassment or assault during their career? It's a variable that goes from 0 to 100 because we have asked them for the share of women that have been victims. And what we do is we run a regression to understand how it's explained by different individual characteristics. And what we find is that if you also, if you have a sexist attitude from the World Value Survey, you are less likely to think that sexual harassment is a prevalent issue in the workplace. If you've been experiencing your sexual harassment yourself, you are more likely to think that, you think that sexual harassment is more prevalent in the workplace. And finally, if you report being more empathic or perspective takers, you also report that sexual harassment is more of a problem. For the sake of time, I don't show you for the two other beliefs. I can show you the result for the two other belief variables because they basically show the same things. Those beliefs are explained by the same individual characteristics. Now, if you look at the workers' constraint, we do exactly the same thing. So the first question, if you remember, is how much do you feel you know what to do if faced with sexual harassment? And here what we find is that mainly what explains this variable is risk-taking, empathy, and perspective. So if you say that you're more like, you're someone that easily puts yourself in the shoes of others, then you're also more likely to say that you know what to do in terms of sexual harassment, and no other variables really matter. However, when we look at the actual score, so what people actually do know, here we find that those constraints are important. So sexist individuals actually don't know what to do, although they do think that they know what to do. People who work with the majority of men do not think that they are worse than others, but they actually are. And empathy and perspective taking also explain actual scores. There seems to be some people that are just better at understanding the situation. Okay, so from those beliefs now and those individual characteristics that will matter in our heterogeneous response to our treatment, first, there is one more question that we need to tackle before we go to this is, do those beliefs matter in explaining willingness to help the victims? So what we do here is we look at our outcome variables. So the willingness to help, remember, is the charity, whether you want to give to the charity and how much you want to give to the charity, and the petition signing. And then we just run a regression with our belief values, our constraint values, and we only restrict the specification to the control group, so those who did not receive information, so that we can just look at the correlation between the two without the information treatment biasing our results. Okay, so for this graph on here on your left, the first three, so for every graph you have first for the whole sample, then women, then men, so pink is men, okay, remember pink is men, and then you have the three beliefs. So first, the share of women harassed in the workplace, the cost for the victims, and the cost for the harassers. Okay, so what we see is that, and the first graph is, are you willing to give to donate to a charity? And the second graph is, how much are you willing to donate? Basically, what there is to say here is it goes in the direction expected. The more you think that that women are harassed in the workplace, and the more you think that victims are actually the ones suffering the most from those situations, the more likely you are to donate to a charity, the more the more you will actually give in terms of money. Okay. Same if we look at the petition results. Okay, again, it goes in the same direction. The more likely you are to sign the petition, the more likely you are to think that, the more likely you think that sexual harassment is a prevalent issue that has a huge cost on victims, the more likely you are to sign the petition. If we look at the constraints now, are those constraints actually mean something? We see that perceived constraint actually does not really correlate much with, or actually not, or at least not for the charity, with the willingness to help. Okay. However, actual score does. And again, if we link it to what explains actual score and what explains perceived constraint, the fact that people don't actually always have a very good understanding of their own capacity to help, it makes more sense. Okay. For the petition, however, even perceived constraint does matter. So that's an interesting finding. We're looking into that, but there might be differences in how public your behavior is. Okay, so again, recap. Beliefs play a key role in driving actions against sexual harassment. Seeing harassment as a serious common issue increases the chance of taking actions. Confidence in knowing how to act doesn't always align with actual knowledge. And policy intervention that could help shape belief. There is room for policy intervention that could help shape beliefs and improve workplace practices. But there is a risk, again, if people think they already know what to do and actually don't. So that might be one of the reasons for the backlash. Let's explore this. So we go to the last part of our papers, which is, now that we know that belief matters, can we change them? And can we improve willingness to help victims? Okay. So for this, again, very simple. We use our survey experiment where we randomize access to information about sexual harassment. And we use exactly the same outcome variables. Okay, so charity amounts, and petition signing. And we run a regression on our treatment dummies. And the omitted group here are the control groups. Our groups are balanced, so no need for controls. The randomization by Qualtrics worked pretty well. So if we look at the result for everyone, so again, the three results: charity amount, and sign-in petition for the three groups, we don't find much. There is a negative effect for charity amount, but actually the thing is, those average effect hides very different patterns between men and women. So here are the results stratified by men for women and men. So column 2 is women, column 3 is men. Same for charity amount. And we find that this negative effect of treatment 3 is driven by men affected to treatment 3. So men in treatment 3 are less likely to be willing to donate to a charity, and they are actually giving less money. Once they have information on, sorry, I didn't recap that, the treatment 3 is the crash course on good practices. So once we give them that, we actually find this backlash effect that has started to emerge in the literature. Okay. However, men exposed to treatment 1 react positively. Men exposed to information about the prevalence of sexual harassment respond positively in terms of donation to the charity. They are more likely to say yes, I want to donate to a charity to help against sexual harassment. However, when we ask them how much they want to give and if they want to give their name to the petition, they don't do it much more than others. So basically, they are reacting positively to the information, but only in a publicly non-committing way. When we actually ask them how much money, they're not likely to say it. So now I've told you that belief matters. Okay, so do they matter in understanding the response to those information treatments? So here, what we do is we stratify the results between those who underestimated harassment in the workplace compared to this 30% that we defined, and those who overestimated. And what we find is that treatment 3 is the negative effects of the backlash effect of men on treatment 3 is actually driven by those who did not underestimate particularly sexual harassment. They know it exists. Yeah, so that's for charity and that's for charity amount. So both are negative. Okay, but treatment 1, however, so giving them information about the prevalence of sexual harassment, the positive effect is driven by people who underestimated it. So we are actually good here at challenging those beliefs, but again, only in a non-committing, very superficial way. For women, we don't find much effect when we aggregate, but when we differentiate by belief again, we find that women react to treatment 2 if again they underestimated harassment. So there are some women that didn't see harassment as such a prevalent issue, and for those one, when we give them actual information about in particular about the cost of harassment, they do react somehow positively to the treatment. Now let's look at those constraints. So when again we've seen that perceived constraint was not really correlated with willingness to help, and actually when we run heterogeneous analysis by perceived constraint, we didn't find much. However, we find that actual score, so how much you actually know, is correlated with willingness to help, and that's actually what we find when we look at the stratified result by the actual score. So here's a simple stratification by whether you had a perfect score or not a perfect score. And again, men able to change their belief already had a good idea of what to do. So they did have a very good score on this test. But men who react negatively, they know harassment exists, but they actually don't know what to do. And finally, for women, again, they can be receptive to information about sexual harassment, especially if they underestimated it, or if they actually didn't know what to do. Then in this case, they're able to challenge those beliefs and to actually increase their willingness to help. Okay, so let's recap. All information treatments have impacts, but it's unexpected. Giving information about the prevalence of harassment does change men's opinion, especially if they underestimated it and they still had some ideas of bad versus good practices. But it only changes their public behaviors. On the other hand, giving information about what to do triggers some negative reaction, even if they seem aware of the issue and they didn't really actually know what to do in case of sexual harassment. So then who are those people? Why are they reacting that way to such, it was kind of confusing for us at the beginning because the information is really lightweight. I mean, the 4D method is something very classic. We're not telling them that they're horrible people and they should learn better. It's really, really classic. So we didn't really understand why we had such negative effect. So actually what we find is that the men that are reacting negatively to treatment 3 backlash basically are the dominant majority. So they are the ones that report mainly working with other men. So in their workplace, they work with the majority of men, which is actually concerning because my co-author Caroline and her co-authors did a very amazing paper on sexual harassment in France and defining the issue using administrative data. And what they found is that sexual harassment is actually more prevalent in places where they are mainly men. So that means that first, that's where harassment happens the most, but that's also where those trainings are not particularly efficient. They're also not really perspective takers. Ooh, who would have guessed that? And it's actually consistent with other literature, especially on the DEI, where the literature has shown that people react negatively to those training when they are the majority group, and when they have a hard time seeing their personal advantage in the initiative. And according to this new paper by Katnitz and al., who defined the typology of response to DEI training, so not just sexual harassment, but general training, those types of responses should be met with dialogue, negotiation, which we should frame the information in a very careful way, which is not what we did with treatment 3. Treatment 3, we just tried to give them information about what to do to see whether that was one of the concerns. So we didn't kind of wrap the information in a nice package for them to be on board with the idea. What about people, men who respond positively to treatment 1? Well, they're basically the opposite. They are men who work with women and they are perspective takers. So men who are exposed to women's colleagues and report greater capacity to put themselves in others' shoes seem to understand the problem once faced with the facts about its prevalence. But they still do it in a very performative way, which again relates to the literature on sexual harassment, and especially a great paper by Kamini Sharma with now an AP at Imperial, and her job market paper was an amazing randomized control trial in India, where she went and gave those sexual harassment training to college students in India. And what she found was that some men were not necessarily changing their core belief about sexual harassment, but what was changing was what their view of what others think about harassers. So basically, they were not thinking now, oh, I'm a very bad person if I harass women, but they were thinking, oh, my friends are going to judge me if I now harass women, and I don't want to be judged by my friends. And so we think that this is what explained this performative results, the social desirability bias, where you're only going to say, well, yeah, I'm a good person, I want to donate to charity, but actually when you have to do something a bit more, you don't do it. So generally, this shows that individual perspective matters. There are typology of responses, so not all bystanders are the same. So that means there isn't a one-size-fits-all strategy in reducing sexual harassment. And in addition to those individual perspectives, the way the change or the way the information is framed interacts with individual characteristics. And that's what we've seen in other papers about other issues. The way information on climate change is shaped has impact on the way people react to it, same from racial equality, in immigration and redistribution, etc., etc. So basically, the idea is giving the wrong treatment to the right people doesn't work, but also giving the right treatment to the wrong people doesn't work either. In terms of the robustness of our results, I'm not going to go into details because it's mainly boring, but our results are robust to a bunch of other specifications, and there are more robustness to do. Of course, if you have comments, suggestions, I'd be happy to take them. But yeah, the idea that our results are pretty robust to a bunch of specifications. So to conclude, I think I'm not doing too bad in time. For you 1 minute. Just to go into the details of our 3 questions. First, our first question was, to what extent are workers susceptible to holding systematic biases about sexual harassment? Workers hold beliefs around sexual harassment, and those beliefs vary by with other beliefs and previous experience. How do these misconceptions impact the willingness to assess victims, where beliefs are important to explain support for victims? And perceived constraints in contrast to some of the literature about bystanders are not so important in this case, but actual knowledge is. And finally, can we change belief and increase willingness to help by modifying the information sets of our respondents? Yes, but not necessarily in the expected directions. Either superficially, what we found is that it's either superficial or even negative, especially for men, which highlight in terms of policy implication the need for more careful drafting of this policy, more targeted training, and that those one-size-fits-all kind of online training might actually not do much to fight against this very complicated issue. So that's all. Thank you very much.